when we bring the patient through in the morning, there's several things we need to take into consideration when they're admitted. There's a few forms that need to be filled in. And after that, when they're brought through to the treatment area, we make some first assessments. We take their temperature, their heart rate, their respiration rate. We make sure that they're safe to go under anesthesia. And we also do some blood work testing to make sure, again, that they're safe to go under anesthesia, they can handle the medication. And those blood work tests also determine what type of anesthesia we can use or the route of administration. It's detrimental to the actual process. After we have all the information, when we make up the anesthetic plan to determine what we're going to do, how we're going to start. After the doctor has authorized the plan, we go ahead and do that. Usually it involves an injection prior to make the animal feel more calmer, that they're not as anxious. We don't want them anxious. We want them to be as calm as possible. Once we give them that injection to make them feel calm, it takes about half an hour or so to take effect. After that happens, we can work with them. They're nice and calm. And usually what we do then, we place an intravenous catheter on one of their limbs, the front leg or back leg. We usually have to shave a little patch on their arm. We place a catheter, and that helps us. So we have intravenous access for giving any further medication. They're on IV fluids, so it helps to keep the blood pressure up while they're under anesthesia. And it also, it helps us control the anesthetic. It's one of the control methods throughout the anesthetic procedure. If we need to increase the fluids or decrease the fluids, then it does help quite a bit, especially with the blood pressure. When we start the procedure, we have a quick assessment overall to find out what's going on in his mouth, because it's one thing with an awake animal to open the mouth and see, and it's a different thing when they're under anesthesia. You can actually use instruments to measure pocket depth if there's any abnormality, so you can much further investigate to see what's going on in the mouth. After we do that, if there's any abnormalities, we use what's called a dental chart, and we write these things down. If there's any abnormal pocket depth or a tooth that doesn't look right, anything that's out of the ordinary. In many cases, we see a lot of surprises, a lot of things that owners, don't see, or even us during the exam, we cannot see because the animals are not always cooperating. And you can't always look at that very last tooth in the back of the mouth that's, while the tongue is in the exam room moving its head or moving its tongue. When they're under anesthesia, we do see a lot of cases where there's all sorts of surprises, where there's abnormalities. If there's any abnormalities, we'll go ahead, we'll take an x-ray of that tooth to further investigate if there's something going on deep where we cannot see. If there's issues with the roots, with the structure of the root, with the formation of the root, all those things that we cannot see, things that are underneath the gums. After the charting part, we actually start what's called the dental prophy, which is scaling. We remove all the tartar or calculus. We remove that off the teeth using an ultrasonic scaler. What it does, it's a very high power, uses high power frequency, and it blasts away all the tartar and calculus, literally. And after that, we'll polish the tooth to a smooth surface. So it'll actually make it harder for plaque and tartar to stick onto the tooth, because once we scale the tooth, there may be still striations. They're microscopic, we can't see them, but there's actually little scratches on the surface on the enamel. So by polishing that enamel, it makes it harder for plaque and bacteria to stick onto it. We'll also do a subgingival cleaning to clean those pockets just underneath the gum where plaque tends to accumulate. So we'll clean those, make sure they're nice and clean. Towards the end, we start to get the patient ready for recovery. We make sure they have a nice, quiet, cozy place to wake up. We'll get them ready for waking up. We'll disconnect or we'll turn off the anesthetic. It comes as an inhalant through the tube that they're breathing, so we'll turn that off, and so they're getting just oxygen. They'll slowly start to wake up. And during all this time, they're still monitored. There's a technician that's monitoring them, checking all their vital signs constantly. Once everything is done, they'll be woken up and transferred to our ICU or intensive care unit. Well, they'll be monitored during the recovery period to make sure that they're recovering and waking up nice and calm, to make sure everything went nice and smooth.